The female body is an incredible thing, but what it endures and what it does can result in some unwanted side effects like incontinence. But fortunately, advancements in medical technology can help. I am here at Hansen Smith Family Medicine. I am here with Dr. Hansen Smith, and we're talking about the Emsella machine. And I've actually seen one of these before. I think there's only 2 of these in the Central Valley, and it's an incredible machine, one that I probably could use myself. What does this thing do?
So this uses a high-powered electromagnet that stimulates all of the pelvic floor muscles. When most women know, you do a Kegel exercise.
Yeah.
You are tightening essentially 2 muscles, and it's very difficult to do them correctly. You've got to tighten, you've got to squeeze, you've got to hold, and if you could do 10 of them at a time, or even, boy, if you're working really hard, 100 of them a day, you're doing like over and above.
Okay.
This machine is like doing 11,000 of them
Oh my goodness.
in a 28-minute treatment.
Who needs this machine?
So there are some studies that show that up to 70% of adult women have some incontinence issues.
Yes.
So there are a couple of different kinds of incontinence. There's stress incontinence, where if you sneeze or laugh or cough, you dribble. There's also urge incontinence. Oop, I've got to go to the bathroom and I can't quite make it there.
Mm-hmm.
There are muscles inside the pelvis as well as the pelvic floor muscles that as we have had children, or even as we just age and we lose muscle mass, that pelvic sling drops. When that happens, the ability to hold on to the urine decreases. So this machine builds those muscles back up so that it tightens up the muscles that you need to hold on to, so that you can cough or sneeze or laugh, or you can make it to the bathroom without leaking.
How would you do this I hear a lot of people talk about pelvic floor therapy. Would you do this in addition to that, or does this sort of take away the need for physical therapy?
This can be an adjunct to physical therapy. I've got some patients who have some pain with intercourse or that sort of thing, and strengthening the muscles will help with that, but there are other things that you do with physical therapy for those sorts of things that are not addressed by this machine specifically. Stretching and that sort of thing.
But this seems like a great supplement if you're if you're doing thousands of these exercises. And how long does it take?
This is a 28-minute treatment. You do 2 treatments a week for 3 weeks, so it's a series of 6 treatments. Some people like to come back once a month and do an extra little top-up every 2 to 3 months, do another set, and that kind of helps to keep things nice and stable.
So we also talked about how, yes, great for women, probably our primary candidates for this machine, but also men can use it.
Absolutely. Women are not the only ones that have incontinence problems. Men have incontinence problems as well. The other thing that this works for is sexual health. So a lot of times when there is not a strong base, there's less of an erection. There's less enjoyment because things don't feel like they used to feel. If we can get things back to feeling the way they used to feel, people do better.
So we're talking about, we want everything in our body to be strong. We want it to be tight and strong so that our function is better. What sorts of outcomes are you seeing with your patients that do this procedure?
Sure. So even within the first 1 to 2 treatments, I'm finding that people are sleeping longer through the night.
Oh, interesting. Well, because you're not waking up to go to the bathroom.
Exactly, because the muscles are not triggered as early because they're stronger. They can withstand more pressure. People are finding that they can cough or sneeze or laugh, and they're not leaking all over the place too. So it happens very, very quickly.
How do you get to recommending this for somebody? And how would you recommend it for women who are younger and who have never had kids?
Incontinence is almost a universal issue.
So that's the first thing we're looking at, is
so
incontinence.
One of the things in just sitting down and talking with people about what's going on with your body, do you have any issues, eyes, ears, nose, throat, lungs, heart, abdomen, extremities, genitourinary system? And that then can sort of bring out, well, I have to wear a pad every day because I can't pick up my kids, or I can't pick up a sack of flour, or I can't jump on a trampoline because I'm just going everywhere. And people have a tendency to limit what they do because of that. They limit being intimate with people because they feel that there's always a smell associated with leaking.
Yeah.
If you go down the grocery store aisles, the aisle that has Depends and Poise pads and Always pads that are meant to help with incontinence issues, it's $1 billion a year business. And a person might still sort of feel like maybe I should have it just in case, but they're going to need it much, much less.
And I think that many women just think, well, this is how my body is and this is how I'm going to have to live for the rest of my life. But this machine can help you.
Absolutely.
I love this. How do people get set up with you? How can they come talk to you about this?
They can check my website, hansensmith.com, or contact me on the phone number that you will be providing on the screen.
Okay, perfect, doctor. Thank you so much.
Thank you.
It's estimated up to 16 million Americans are living with long COVID. Next, we speak to a doctor who tells us everything we need to know and steps you need to take for prevention. We'll be right back.